Hi mamas, today we're going to be talking about torticollis in babies. So what is torticollis? So torticollis is when the baby's neck is stiff and stuck and kind of gets twisted where it's continually bent to one side, and it makes it difficult for the baby to kind of turn or rotate its head. A lot of times this is often overlooked or missed by pediatricians and other practitioners. If it is found, sometimes they just say, oh, let's watch and wait. Let's kind of see how it does and kind of go from there. So as a pediatric chiropractor, we look at this really differently, and we take torticollis really seriously in our office. So what are some signs? How would you know if your baby had torticollis? Well, first of all, like the bent head and the twisted neck would be one indication. If you feel like your baby has a lot of frequent crying and colic and irritability, that could be a symptom of torticollis. Difficulty latching and nursing, or if they're favoring one breast over the other, they nurse really well on one breast, and then when they go to turn their head to the other side, they don't nurse well on the other side. Babies with torticollis tend to have some reflux and digestive issues. Limited range of motion when they're trying to turn or bend their neck is definitely a symptom of torticollis. Every time they're in a car or on their back or in any kind of swing, they always put their head in one certain position. You're like, my baby never turns their head to the right or tips their head to the right in their bouncy seat or in their car seat. They're just always in one position when they keep their head, when they're on their backs. Difficulty sleeping. Sometimes babies, if you can't turn your neck, you're not going to be able to sleep well. So a lot of times babies being up at night or being really fussy when we put them in a sleeping, kind of relaxed, reclined position is a sign of torticollis. Obviously, if you look or feel at their neck and you notice that it's really spastic or really tight, some babies will have a little lump in their neck. Some babies will have asymmetrical facial features, which means like one of their eyes kind of droops a little bit, or everything just doesn't look really symmetrical when you're looking at them. When babies have torticollis, it does actually make them more susceptible to have plagiocephaly, which is a flat spot on their head, which we will do a whole nother video on. And it also can cause them some motor delays, because they can't move their head and do some of the developmental things that they should be able to do if they could move their head properly. So we see this a lot in our office. We have a lot of moms come in. They're not coming in for the torticollis, but we find it. A lot of times there's birth trauma, C-sections or really aggressive births, forceps. I had a mama who her baby had broken its collarbone during birth, and so she's got some torticollis. So we do see it a lot, and we find it kind of secondarily when they come in with all these other complaints. So like we said, what are some causes? I talked about traumatic birth, but there really are two causes. One's called congenital and one's called acquired. So congenital would basically be when the baby is positioned abnormally in the uterus. And so a lot of times breech babies, this can happen, or babies with really low amniotic fluid will be really crunched up and positioned wrong inside of mama, so they come out and they already have a torticollis. There are some congenital and genetic disorders that cause issues of the muscles, like Klippel-Feil syndrome and other issues like that. But usually those are caught, right away and noticed right away by your pediatrician. So acquired torticollis is what we talked about. The most common is birth trauma. So C-section kids get a lot of torque and twisting on their neck. The forceps delivery again, if you have shoulder dystocia where their shoulder kind of gets stuck in mama's pelvis, that can cause a lot of issues in the neck. So what happens when all of this birth trauma or, just basically rough deliveries, how does that cause torticollis? So this leads to stuck stress in their neck, which is what we call subluxation. So subluxation has three components. One is misalignment of the spinal vertebrae. One is reduced range of motion in that stuck segment, that neck can't move like it should. And then we affect the nerves around that area. So we get some neurological interference because the nerves and the joints aren't moving good. So what are your treatment options if you do know your baby has torticollis? So usually the pediatricians refer to a physical therapist or an occupational therapist. They're going to do some stretches on the baby. Most of the time, they're going to put your baby in a helmet. Most parents do not want their baby in a helmet. A lot of times we can work with your PT and your OT to get the baby faster, because we can remove that stuck stress in their spine. We can actually do some gentle adjustments on those subluxations, whereas PT and OT are just dealing with the muscles. Most of the time we can keep them out of a helmet because we're treating the root cause of that tension in through their neck and shoulders. So the pediatric approach to caring for torticollis is the one that makes the most sense using chiropractic. So we find and locate the area of the trauma to the neck, that subluxation. So we make gentle adjustments, basically the pressure of checking the ripeness of a tomato. That's all the pressure we use in adjusting these little babes. And then we tell the parents, we encourage them to do stretching at home, increase tummy time, and we also watch for this reoccurrence of torticollis, which I don't think parents are really aware of, during growth spurts or teething or colds and illness. Anything stressful that the child may experience, those subluxations return and get their neck kind of twisted and tight again. So we find these areas by using our insight scanners in our office, and they are amazing at finding where the stuck stress is, how much is there, and how long it's been in their spine. For some of these babies, it's been there 100% of their life because they were born with some birth trauma. So what's really cool is we can measure these improvements over time. We can tell if we're making improvements in the baby. Yes, all their symptoms are going to be better. They're going to be able to move their neck better. They're going to be able to nurse better. But we can actually measure the amount of stuck stress that's being removed from their spine. So one thing I want to caution you about is this watch and wait procedure that sometimes you guys are instructed to do. Let's just wait and see. So kids who have unresolved torticollis are going to be more susceptible to things like ear infections and other respiratory infections like cough, croup, even RSV. Because these subluxations in the torticollis, they limit the movement in that upper neck, and then they don't allow everything to drain. So all of the mucus, all of the secretions don't get to move through the respiratory system. So remember from our ear infection video, the two causes of ear infections are poor plumbing and low immune function. So if all of this stuck stress is still in that upper neck, that plumbing system can't drain and their immune system is going to be compromised. So then we get all this upper respiratory stuff and ear infections and yucky things. So I really, really caution you to not watch and wait and to get treatment right away so that baby can not have some of these chronic issues. And we want them to heal, and it takes time. This torticollis takes time to heal, and so you need the right treatment, and you need to be in the hands of a good pediatric chiropractor, a good pediatric PT. We can all work together. So if you know a mama who's struggling with torticollis with their little one, please share this video, please share this information. We would love to care for your little one and give you more information about torticollis. So contact our office through Facebook, Instagram, or give us a call. So we appreciate you.